Good morning, students. Today we will learn about the restraint, that is your subject foundation of nursing. In that unit name is a meeting the needs of client. So in that today we will learn about the restraint topic. So first of all, what is the meaning of the restraint? So restraint in simple terms, we can identify that restraint to prevent any activity by doing, exhibiting or expressing. Okay. So hyperactivity we can control by the providing restraint. So as an example, we can restrain small child by jumping, okay, or by preventing from any illness or from any injuries, okay. So that is controlled by the restraint, okay. So definition, first of all, restraint in the medical setting are items that limit the patient's movement, okay. So we can control the patient's movement by providing the restraint. Restraint can help keep patients from harming themselves or anyone else, including their caregivers also. So, when we can provide the restraint to a particular patient or person, that is for preventing any harmful activities or risk from for themselves or anyone else, including their caregivers also. Because in some patients like mentally retarded or mentally ill, they can harming themselves or anyone else or their caregivers also. So in that case, we can provide a restraint to the particular person or patient. So these are protective device to immobilize particular body part, to restrict the activity and to promote a feeling of security in a client who needs a control. So a person who needs a control and safety purpose, in that case we can provide for immobilization of the body part, restraint is provided. Okay, so this is the basic term or definition of the restraint. Next, that is the what are the objectives for the restraint. So first of all, to avoid client from falling, as I told earlier that we can control patient's movement or immobilization and providing safety. So how we can provide a safety to the person? So from falling down or from any harmful activities, we can control that client. Then to prevent the interruption of a therapy. So in that case of restraint, we can provide a interruption of therapy. So that interruption we can control by providing the restraint. So in during therapy time, the interruption can't trouble to the patient. Then to prevent confused or combative client from removing any life supporting equipments. So we can provide a patient some kind of the restraint in which that case patient have not need of the permanent life support equipment. So in that case we can provide a restraint. So they can free and they can freely enjoy their life and not any burden on their body parts or life. To reduce the risk of injury to others also. We already discussed earlier that in such patients like mentally ill or psychotic crime, they can harm themselves or anyone else or even their caregivers. So in that case, from any injury, we can provide restraint and feeling safe and secure to the patient and surrounding people also. So these all are objectives of the restraint. Next, what are the types of physical restraint? So there are many types of the physical restraint like particular age wise and safety purposes. So first of all, that is a mummy restraint, which are specially used for the babies. Then elbow restraint, extremity restraint, abdominal restraint, jacket restraint, mitten or finger restraint. So For particular immobilization of the body part, we can provide different type of the restraint to the patients. Okay, so these all are 6 physical restraint types. Now we will learn one by one in detail. So first of all, we will discuss about the mummy restraint. So what is the meaning of mummy restraint? So it is basically used for the restrict movement of the limbs in small children during a procedure. So we can provide this mummy restraint to particular at the small age of children for restricting their limbs movement, means hand and legs. So for restricting their limbs movement, we can providing mummy restraint, which is shown in figure. Okay, so by this we can provide a mummy restraint. So hold tightly, tie up with any cloth to the child for restricting their movements. See, in this figure, how to tie up to children for restricting their limbs movement is shown in this figure. First of all, first part, take it like this, then wrap it in another shoulder and then tie up by this manner. So the properly tie up with that cloth, children's limbs movement can restrict by providing the mummy restraint. Okay, so this is how do the mummy restraint. Second type of the restraint, that is elbow and knee restraint. So by name we can identify how to provide the restraint particular on the elbow and knee parts. Okay, so it is applied to prevent flexion of the elbow and knee joints, because there are many bones and joints in our body are situated. So by doing more flexion and extension, it can cause to the our body strain or pressure. So by preventing that flexion on knee and elbow part, we can apply the restraint. So the elbow restraint prevents the flexion of the elbow and to prevent the child from any reaching dressings or tubings on his body. So we can also apply for children for preventing that reaching dressing and tubings on their body. So there are two uses of the elbow and knee restraint. Okay. See, in this figure also shown how to tie up for the knee and elbow joints. So how we can prevent the flexion of the elbow joints. Okay, so in this figure B, it is applied elbow restraint. See, this kind of the tie up by providing the restraint. Third one, that is the extremity restraint. These are used to restrict the activity of the limbs, as we are discussing into the mummy restraint, but in that we can particular restrict the limbs movement of children, means in small age group. This is extremity restraint we can providing in any age group. So for restricting the limbs activity in a client who are potentially harmful to himself or others, to prevent the client from removing appliance used in treatment and immobilize one or more limbs during the procedure. Obviously, if patient is harmful for her or himself or any other one also, then in that case they interrupt into any procedure or giving treatment. So in that case we can restrict their movements by applying the extremity restraint. Okay, so this is the extremity restraint by restricting their limbs and extremities, upper and lower both extremities. See, in bed, her hand, okay, and legs both are restricted by providing the extremity restraint. Okay, so in figure we can find easily. Fourth one, that is finger or MITT restraint. There are two names, finger or MITT restraint. It is used for children or confused client to prevent them using their fingers or hand for removing tube, dressings, and another appliance used in treatment, because we all know that anyone not liking that treatment or pint or giving some treatment to themselves. In children, these are most common. So in that case, they can remove the tubings and dressings also. So in that case, we can provide finger or meat restraint for not interruption in during the treatment or procedure time. So the meat restraint prevent the client from using the hand. So they can't move their hand for any purpose. See, while we providing some vein insertion or pint insertion, children can move their hand easily because they have fear for the syringe, okay, and needle. So in that case, they move their hand. But in that case, we can provide finger or meat restraint, okay. Next, that is the jacket restraint. It is used for the children and adults. The jacket is usually put on tie at the back side and strap from the jacket are that tied to the bed frame under the mattress, thus preventing the client for sitting on bed. Means we can provide client from sitting on bed, means they can't move from bed themselves, okay. So in that case, we can provide the jacket restraint. We can providing both, that is children and adults. See, in this figure it is shown one type of jacket, and by back side we can tie up, so can they can't remove it. It is fixed on the patient's body, okay. So they can remove by themselves. So these all are the types of the restraint. If you find any doubt, you may notify to me, okay. Thank you.